I'm Randy Reed, editor of the EdisonReport, and we are in Washington today for the 3rd Annual National Lighting Bureau Board of Directors Forum. As in past years, we will focus on issues affecting the industry. Our first panel is Light and Health, and I am joined by Howard Lewis of the Viscor Group, who is representing IES, Mark Lean of Osram, Sylvania, Dr. Mark Ray of the Lighting Research Center, Mary Beth Gotti of GE Lighting, Jay Goodman of Lumen Optics. Welcome. Howard, as the chair of the NLB, we'll give you the first question.
Okay.
What are the positive effects that lighting offers on health?
Well, there's quite a few. To name some of them, with the research that's in play, positive effects include Alzheimer's patients that sleep better, aiding the human circadian system, the ability to do tuning where sunrise and sunsets can be simulated in a patient's room or home. And I'm going to address this one to the board because I also believe that with the ease of RGB control of LEDs, research is being done with certain wavelengths to see how it affects cancer cells. And those are the ones that seem to be the most prevalent. I would ask the board if I've missed anything.
Well, certainly daylighting in intensive care units has shown that people can recover quicker. So we've seen substantiation of that. We've seen substantiation of daylighting's impact on test scores for math and English. And there's marked improvements just from the introduction of daylighting into some of our interior environments. And I brought some other examples too of things that people may have heard of the effects of lighting. And of course we have Dr. Ray here who could talk to whether these can be substantiated by current research.
One of the things I'd like to add to the discussion up to this point is that individuals make a big difference. Not everybody is going to benefit or be penalized by bad lighting. We're really talking about averages to some extent. You know the story. You know, my grandfather smoked a pack a day until his 95th birthday, and it didn't matter. But no one questions the negative impact that smoking has on our health. So I think we need to be prudent and not alarm everyone, but begin to think about the individual. So what we do see benefits are people that, for seasonal depression, which you didn't mention, is one that is clinically approved treatment for light and has been shown to be efficacious for that treatment. But I think more generally, any sort of light-dark pattern over a 24-hour period that disrupts the night-day cycle is potentially harmful to individuals, but not necessarily guaranteed harm for everyone.
Just my own personal perspective on all of it is that it just appears that we as an industry are on really the cusp or the infancy of understanding that people as a whole are affected in far-reaching ways really by the sun, whether it's the intensity of the light from the sun, whether it's the rise of the sun, the set of the sun, wavelength or color of the light coming from the sun. So my own guess is the research that's being done now, some of the empirical evidence that'll start coming back to it is really just the tip of the iceberg, that so much of our health and well-being is really dictated by the natural sun. So I think it's an incredibly exciting time where lighting is more than just being able to work indoors. It's really tied to living under lights.
And I agree, it's an exciting time and there's lots of change, but why don't we have those answers already? I mean, we've had light for quite a while, as I understand it. So, and we've had electric light now for 135 years, at least Edison's version of it. Why don't we have more research to substantiate some of these claims that we're hearing?
I just think from a depth of research, funding, what questions to ask and what to study, I just think it hasn't been discovered yet. I mean, we treated ulcers with buttermilk and diets, only to find out that years later it's a bacterial infection. We just haven't gotten to the point yet where we've studied it enough and learned enough about it and compiled enough evidence.
When was this new retinal ganglion cell that can respond to visible light, but not for vision, but for circadian rhythm effects? That was discovered, what? 2001. So,
Amazing.
you know, and it kind of opened up, you know, a whole new arena of experiments, or maybe an evolution of experiments that are really fine-tuning and really revealing more of the secrets of how we work as people, not just how we see.
With respect to Alzheimer's, how can lighting improve Alzheimer's patients' lives?
Well, many Alzheimer's patients lose their ability to understand when they should be sleeping. Unfortunately, I'm one of these people that has a mom that's suffering with dementia, and so not that we've been able to do a lot of experimentation because she won't allow it, but many of the things that I've read do point to the fact that if you can actually control the amount of light in the space, and again, I'm not sure of the wavelengths because that's still being addressed, that they can actually get them back into a more normal pattern of sleep, so that they're not so that they realize, you know, what day and what night is, because they actually kind of lose track of that all told.
Mark?
Yeah, in Austin, Texas, probably 5-6 years ago, they actually did a study with Alzheimer's patients where they increased the light level to 10 times the IES recommended level inside, and they took the patients outside into the daylight for a longer period of time than they had, and they saw two things happen. They saw that there was more engagement of the people. They interacted more. What happens, and I have a friend who developed Alzheimer's, and he told me that what he was feeling was that he didn't remember people's names, and he didn't remember things that he should have, and he knew that there was that gap there, and he was troubled by it. So what happened was he would withdraw and just not sit down with these people. He'd be quiet rather than engage because he'd be embarrassed.
That's exactly what she says.
Yeah.
100%.
So what happened when they were exposed to higher light levels inside, and particularly the sunlight, the brighter light outside, is they found that engagement improved between the staff and the patients, as well as the patients themselves. And the other thing that they found is that they were sleeping more, and they had better sleeping patterns at night. It wasn't as disrupted. Alzheimer's patients often wake up, they don't know what time it is, they stay up, and they have disrupted patterns that affects their quality of life.
Okay. Dr. Ray, if you were to pick one application where research into light and health can inform practice, what would it be?
Well, I think the obvious answer is seniors. We talked earlier about Alzheimer's, but I just want to generalize that sleep problems are common in older individuals that may have to live on their own and so on. And a regular light-dark pattern will improve their sleep quality. In fact, it's more efficacious for people who do not have Alzheimer's than people that do. The problem is we create these very static institutions with low light level to save energy, and we rarely modulate the light so that they're getting bright light during the day and dim light at night. Now, Dr. Van Summeren of the Brain Institute in Amsterdam was really the first to point to the efficacy of light treatment for Alzheimer's. And I think it's important that we all understand, and this was alluded to before, we're talking about a lot of light. And that's why we pick daylight. But in principle, the physics is such, you can create an electric light source, particularly taking advantage of the inverse square law and get it close. And that's our research, is really looking at how do you deliver light to the people that aren't sleeping well in these institutions that have this static low level 24/7. And I think that to inform practice, we have to get people to understand it's modulated light for that group. Now for you and I that walk outdoors at lunchtime and things like that, we're not confined to those kinds of spaces. So we get our bright light generally during the day, and with good habits we can have dim light at night, but not people that are institutionalized. And I think it's mandatory the lighting industry specifically address this, because we can make a difference for seniors. And this is really the story that Dr. Figuero's in our labs been talking about for years and years. We don't have the standards or the applications ready to apply that. And yes, maybe it's a small market, but that's something the lighting industry could tomorrow make a huge difference.
Mary Beth?
And I think that the key in the research that the Dr. Ray and the lighting research and others have done is trying to create this recipe. Because people say, okay, we'll buy in. What do we do? And how do we do it? And how much? For how long? And that's where the details, you know, the devil's in the details, right? I mean, you need that recipe, that prescription, so that people can implement it, or else it doesn't get implemented.
Well, I mean, as an engineering society, you think we would go to the point where we could develop specifications, and recipes one way, but I tend to think of them as lighting specifications. Not only spectrum and amount, but the duration and the timing become critical. And that's perhaps pushing the industry a little to a point where they're not as comfortable when they talk about time as part of the design characteristics that need to be specifically specified.
Okay, so Jay, let me direct this to you. Let's say we get those specifications that we're talking about. We get this recipe. Will the value of light and health at these institutions outweigh the energy?
I think if the story is told properly, absolutely. I mean,
You think we'll do
value
it?
of
You
life
think
and health
you
is
think the industry will do it?
Is exponentially larger. I think the markets will demand that the facilities and institutions that cater to the people implement. I think you'll start finding people won't put their parents or a loved one into a facility that doesn't cater to lighting that enhances their health or improves their condition.
I agree. Mark?
Let me give a really illustrative example, I think, about the problem with having a good idea that you've demonstrated works in research, but there's still nothing is done. We made a presentation, Dr. Figueroa and myself made a presentation to the board of directors of a senior living facility in upstate New York. The results were very clear. I mean, we had all the data you need to demonstrate that not only were Alzheimer's sleeping better with light treatment, so were the institutionalized people that were not demented at that point. And we went to the board and we were very happy, and we thought they were going to implement it tomorrow, and they said, no, we've already set our annual budgets, we can't do that. Is there something the children or the grandchildren can buy with a plug on it that they can plug in to do that? So the institutions have their budgets and their priorities, and this doesn't rise to the top. Even though you can show demonstrably reliable effects, it's still going to come down to who's responsible, and they're trying to shift the burden onto the children and grandchildren. So our research, Dr. Figueroa and myself, is really trying to come up with things with plugs on them, and we have been now working with industry to come up with luminous tables. And not only, I think Mark mentioned it before, they gather around it and they actually interact socially around these very bright tables. Now, most of us say, wow, that's glaring, people don't like it. But the nurses and physicians and the children and grandchildren want us to keep those there, so we've introduced more into this facility. The trick is getting people to understand that you can make the difference, yes, but you still have to write a check somewhere to make it happen. And that seems to be a barrier that we could address, I think, as an industry.
And part of it, and I'm going to steal one of Mark's lines, but the value proposition for lighting needs to be redefined. I mean, in other words, would they hesitate to buy brand new microwave, new medical devices, new imaging devices? That's less of a problem. Oh, lighting? No, it's not my budget.
Okay, good point.